Well, kia ora koutou. It is my pleasure to come back to you and talk to a couple of very esteemed colleagues of mine. Sir Ashley Bloomfield, the former Director General of Health for New Zealand, most of you will know him, and Stacey Wood, who is the Langdon Distinguished Professor of Marketing at North Carolina State University, who is visiting UC at the moment as an Erskine visitor. We thought we'd come together and have a really quick chat about a range of things. Stacey does a lot of research in health space, and obviously Ashley has been a regular person on our screens and in our minds over the pandemic, and how you navigated that space, and now moving into a new role with the University of Auckland. And so we're just going to have a little chat about what their experiences are, what we can learn from the last couple of years of the pandemic, but also what we can learn as leaders going forward. So I always like to start with a little bit of whakawhanaungatanga, so I wonder, Sir Ashley, if you want to introduce yourself and maybe tell us a little bit about what has brought you to this point, what drew you to health in particular, and the role in health that you have taken over your career.
Well, thanks, Ekan, for the very kind introduction, and kia ora koutou katoa to everyone. This is not a COVID-19 announcement. Yeah, look, I mean, I left school with this ambition of becoming a doctor and studying medicine, which I did, and I really I enjoyed it. And then I decided a few years into my clinical work to specialise in public health. And sort of on a whim, I thought I need to get a little bit of experience in the public service, in the policy space. So 26 years ago, I moved to Wellington for 6 months and am still there, living in Wellington. But I found that nexus between the public health and the public service just really was my place. And I really found the public service in particular got under my skin. So ended up staying in public service type roles, a year in Geneva at the World Health Organization, which was very rich. And then after actually a critical moment in my career was missing out on a job. Now, I don't know, if you've ever had this, but I applied for a role that I didn't get. And interestingly, it was a role I had been acting in for quite some time. And it didn't feel great at the time. But just a couple of days later, a phone call and an opportunity came up. And it was actually that opportunity that led me on the trajectory of becoming a district health board chief executive and really advancing my executive leadership career. And then a few years later, back in 2018, becoming the Director General of Health.
And Stacey, I know we've been colleagues for a number of years, and as a visitor here, I've got to know a little bit more about your career trajectory, but starting off in innovation and understanding consumer change, and now more into the health decision making. Tell us a little bit more about what drew you to marketing in the first place, and then where you are now.
Well, it's definitely been an interesting road because as the daughter of an engineer and a nurse, they hoped that I would become a medical doctor. And so becoming a PhD in marketing was maybe not what they hoped for. And yet, early on, I started studying innovation. And so I really look at the psychology of innovation. What are the things that help facilitate change, help make for successful change? And I've done that over the last 20 years, a lot in high technology. And then about 6 years ago, I met Dr. Kevin Schulman, who was at Duke University at the time, has since moved to Stanford. And he thought that the next greatest innovation was going to be in healthcare. And he wanted to try and work together on issues that were all about innovating in that healthcare and digital healthcare space. And that was a few years before then a pandemic struck. And so I found that my work on getting people to do new things in healthcare was a really valuable skill set. So I've been working with a lot of institutions and organizations in the US, looking at everything from social distancing to mask wearing to vaccines to boosters, and preparation for kind of what's next on the health sector.
And I wonder if we can jump into that then. I grew up in a medical family. My dad's a real doctor. My older brother's a real doctor. PhD means phony doctor, according to my mom. But that tension, I grew up in this household where my dad would constantly say, I hate administrators at hospitals. They're always trying to slow me down. But you were talking about that relationship between health and service as well. I mean, how do you navigate that tension between being the health professional, but also trying to take the leadership role of trying to make sure everyone is supported in the health system?
A couple of reflections on this. First of all, and thinking back, particularly to my time as a district health board, senior executive and then a chief executive, Those are not roles for the faint-hearted. But you know, where I felt things worked best was when you had this really strong partnership. We talk about sort of the clinician-patient partnership, but that partnership between the clinicians and really good executive managers, because the latter can bring to bear a lot of support and resource that absolutely makes the role of the clinicians so much more enjoyable and actually better, and especially in terms of innovation. You know, clinicians are always full of ideas about how things could be done better. But for the lack of someone with a bit of project management around them, some actual ability to get resource, quick decisions around applying resource. And when I took over as the chief executive, interestingly, at Hutt Valley DHB, there had been a falling out between the chair and the chief executive. And it's amazing how quickly organisations can go into free fall in that sort of situation. And so, and the key thing was decisions had stopped, decision making had stopped. And I can remember getting there and the senior clinician saying to me, you know, can you just make decisions? We don't mind if the answer's no. We'll be grumpy, but it's about, you know, running hot and cold is the worst thing. And so, you know, the role of really good executive leaders and managers and good decision making and supporting great clinical care is just fundamental, really, to a well-functioning organisation, healthcare organisation and healthcare system. So that's the sort of part of the system that I really enjoy.
Sure. Yeah. And we were talking about this just at coffee earlier, just that the importance of building that level of trust, building that connection, building that humanization aspect. And you were talking about Mohammed Bapate's work as well and trying to express that. I mean, building that level of trust, though, in order to engage an entire nation, or in the case of a pandemic, an entire world, that's got to be difficult, right?
Yeah, building trust in innovation is a critical key, and it's interesting to see that the administrative trust flows through the clinical care provider. So it's as if the executive building trust with the service provider then benefits the end recipient, the patient, and their outcomes, because that physician, that caregiver, sees what trust is and can then build upon that. So I think that's really critical. But there are so many ways that that personal interaction between physician and patient is whittled down in today's healthcare environment. You know, with 15-minute appointments and only seeing people when you're really deathly ill, you don't really have that time. And so you've got to look for many ways in an augmented environment, everything from texts that your caregiver might send you to things you might see on their social media, to try and build up that sense of, I know who this person is.
That level of connection. And the 1 p.m. stand-ups are gonna stay in our minds, I think, as New Zealanders. And you were saying you started those like 2 months before we really came into lockdown in January sort of time. And what sort of preparation did you have for these? I mean, I don't know if this is something you put on your CV, really good at facing the nation every day for 3 years or whatever it was.
Yeah, well, I sort of joked when the pandemic came along, and well, I've talked openly about the waking up at 3 a.m. in a cold sweat for weeks, thinking, you know, why me? I've only got a 5-year contract. You know, why is the one in 100-year pandemic happening on my watch? Now. I did not read the fine print here. I had done, in fact, earlier in my career, before the rise of the political advisor and the much tighter control by ministers and governments of the whole communications and media interface, as technical specialists, we used to front quite a bit of media, and so I had done some media, sort of fronted media issues earlier in my career, and then as a DHB chief executive, so I was comfortable and familiar with that context. I hadn't anticipated I was going to be doing it every single day, you know, alongside the Prime Minister for long periods or alongside a minister. But like most things, like any skill, including leadership skills, the more you do them, and if you reflect and are open to feedback, of course, it's like a muscle. You can develop you can develop the skill, you can develop the fitness, as it were. So for me, it was just a matter of really starting out. And here was the most important thing. I came back about 2 weeks into the, 2 or 3 weeks into doing this daily stand-ups. Before that, they were just becoming a bit of a thing. And the staff in my office were looking at an online media post or social media post, which was sort of making a bit of a fuss about it. And they laughed and they said, oh, look at this. And they said, we don't get it. We just see you up there every day being yourself. And I said, tell me if that changes.
Yeah.
Because this was the most important thing. I didn't know when I did the first one what was going to play out, but all I could do was get up and be myself. And part of that was being really honest about what we didn't know as much as what we did know. And here's the thing, I think that was fundamental to building trust. People don't expect you to have all the answers. And it's the same as a clinician. You know, we think we've got to have all the answers, and when you're a chief executive, well, you think the only reason I've got here is because I've got to know what's going on. But actually, when you go, I'm sorry, we don't know, well, I don't have that information, but I'll come back, or I've changed my mind because I've got better evidence. People go, that doesn't undermine trust; it actually builds trust.
And that humanization aspect, you know, that makes you more human. It makes you more relatable. And the fact that you and the Prime Minister were both so visible so often, or it might have been your deputy or the Deputy Prime Minister, so visible, I think did play a lot into hopefully bringing the nation together. You were talking about it was pretty much the only show in town for a while, so you had a captive audience. Were there ways in which you kind of thought, this is a real opportunity to kind of maybe slip in another message that could help and stuff like that? Or was it very focused the whole time on the core messages?
Look, it was very focused. However, you know, I couldn't, for me, the fact that I come from a public health background, and in fact my background and my professional expertise area is in non-communicable diseases, not necessarily that helpful when a global communicable disease pandemic happens. The principles are the same, particularly in epidemiology. You know, one of the things, and this goes to the heart of your work, is we were asking people to behave in certain ways that were completely at odds with, you know, they're completely foreign, they were novel for everybody. So it was actually that the fundamental principles were the same, and often we were asking people to do things that weren't necessarily just about the response to the virus. They were about looking at, you know, we're asking people to look after each other. And I often talk about the call to action, which was, I think, developed by the comms team. I suspect the Prime Minister had some input into it, but this tripartite call to action, stay home, save lives, be kind. It's a very different message from stay home, save lives and look after yourselves. It's saying stay home, save lives and look after each other. And it was, so there's nothing public health or medical or anything about that, but it's still a call to action, and one that I think inspired a lot of people to do exactly what we needed them to do, actually act collectively in each other's interest.
And it seems too like you guys saw something that we did in the US, which was there were a lot of upsides to the pandemic in terms of creativity and coming together, and there was an openness in the midst of upheaval to saying, well, let's just give it a go. This isn't going to be perfect, or we don't know 100% whether this will work out, but this seems like the best way. We're going to go in this direction. And we found that a lot of areas, both in healthcare and just in other sectors, the arts, schooling. You know, our school teachers got very creative. But it was that sense of we have a time when we need to pull together and be kind, be creative, and everyone just gave each other a break a little bit, right? This might not be perfect. We might not know exactly the full story, but this is what we're going to work with.
And I wonder if it's something uniquely Kiwi, or if we have history, especially in the city, with regards to some tragedies that we've had over the last 10, 15 years. But we know how to come together when we need to. You know, when we're like, all right, we understand what's going on, let's get through and do it. The actual adherence to what was required and the trust maybe in the messages being presented and by whom they were being presented could have helped in this sort of space. I mean, do you feel that's a big part of this, or were there other factors? I mean, I know whenever I go online and people say, well, of course you were safe. You're an island nation on the end of the earth. You can shut the borders pretty quickly. I'm like, there's lots of violence around the world. They just made different choices. What do you think really helped New Zealand in particular adhere to the messages or come together? Are there things that we can translate into future campaigns or future changes that we want to bring, especially in the health space? I
think two things. First of all, I mean, we can't deny this. People were frightened. And fear is quite a strong spur to action. And I mean, everyone was anxious. We didn't know what was going to happen. We could see what was playing out in the UK, where many Kiwis have family, friends, colleagues. They might have spent some time there themselves, and we could see a health system from being overwhelmed. And you know, this is one of the groups that's most appreciative of what we did here. We're health professionals, because as one described to me, they said all we could see was this long dark tunnel ahead of us and no way of avoiding it, but we did. So I think the fear was part of it, and so people were receptive. But secondly, and maybe this is as much a personal view as it is, but I think it was borne out as, I don't think there was anything uniquely Kiwi about it. I mean, some people say, well, Kiwis are sort of, you know, much more compliant than others are. No, not. Actually, but have been for quite some time a great fan of this idea that actually, contrary to some of the research done in esteemed universities in the US, that humans in the 60s and 70s, that humans purportedly demonstrating humans are fundamentally, you know, not good, bad, and that kindness and doing good are exceptions. Actually, you'll be familiar with some of the more recent work. So Dutch author Rutger Bregman has written a lovely book, Humankind, A Hopeful History. That actually, that's what distinguishes humans from other species and has been fundamental to our development and survival as a species, was our ability to cooperate with each other. And so actually, when the invitation to collective action was extended, best definition of leadership I know, it's an invitation to collective action. Be kind. It actually played to a fundamental human and something that's evolved for us as a species. And so people then thought, okay, it's fine, I can do that. I can ring my elderly neighbour, I can check with such and such if they need us to do something for them. And it's a rewarding behaviour.
It is.
It is a very rewarding behaviour, doing things for other people, and I think we saw that playing out.
Yeah, I mean, the 5 Ways to Wellbeing talks about this. Give is a key part of it. And it's not just giving things, it is giving time, giving energy, giving space. To be a little bit controversial though, that works really well in the midst of it, early on in particular, but as time goes on, when people get tired, when they're like, I don't see the end of the tunnel, it can start to grate, it can start to get people up a little bit. And we did see more of the online chatter in particular. Said if Jacinda says be kind one more time, I'm going to lose it because I don't feel like being kind right now. And I think we have to be reflective as well about how long this had gone on and how amazingly everyone has done despite the difficulties there. I wondered, Stacey, just from your own work as well, if you wanted to express a little bit with regards to some of the key takeaways you're finding with regards to driving change, especially in the health sort of space.
Well, I think one of the key things that I learned over the arc of the pandemic was that it's really important to think about different subpopulations differently. Like we've talked about in the past, there's no one message that you can give in a health sector that's going to be meaningful, unless it's at an incredibly abstract level, like be kind, right? Like that's something we can all do and it's good for everybody. But there were too many times where people felt unseen with a one-size-fits-all message. So in the US, we struggled with pregnant women. We're not sure whether the vaccine was safe for them, and because the message was, yep, everyone just get it, get the vaccine, they didn't feel like that quite saw the uniqueness of their own current situation, people with chronic illnesses, and so I think that we need to be a little bit better about understanding the differences in why is someone not acting in the way that we're hoping, and find out what is that one hurdle for them and address it specifically for that population. So that idea of segmentation in healthcare communications is really important. You know, we're not going to have that nice one big poster, you know, keep calm and carry on. There's got to be something a little bit more targeted. And then the other part was just that as clinicians and working with doctors and organizations, they had such a logical view of it. For them, there was a right answer. And for them to step back and think a little bit more about why people were not getting vaccinated and what reasons might be, you know, valid, not valid, or at least something they could empathize with, was a key factor. And in many ways, as Sir Ashley mentioned, there was a need to change your message and change information over time. And yet we don't really have very good narratives of how information changes. We expect to be right in the beginning, and if you change, that means that what is happening is you are, in the US we call it flip-flopping.
You were
and
wrong
it's terrible.
the first time.
You were wrong the first time. And so part of my research looked at how you could take information that was trending down, it was looking worse and worse and worse, and see that people reacted much more negatively than if you told them the most horrific news right up front. There was something about that trend that was worrying in and of itself. So I think for the next go-around, thinking more about how we can pull in narratives of change that say, here's what we know now, here's our best information now, this is likely to change, let me prep you to know that there are going to be shifts in our policy, is going to be important.
And I think that comes from trust in scientific process as well. I saw a few messages going out saying, no, the fact that we've changed our decision shows that science is working, because now we know more. We have different ideas. It's not that we were wrong before, it's that that was the best decision based on the information we had. It is difficult to get a mass population behind that if they feel like the goalposts are changing, I guess.
Yeah, this is a really important point, and it depends. It also depends a lot on who's giving the message. And I think one of the advantages we had here was that our media stand-ups started with myself and the Director of Public Health, Dr. Caroline McElnay. So we were there, we're not politicians. So as we were saying earlier on, actually the answers to most of the questions in the first stand-ups were, we don't know. And that's okay. Actually, I think people don't expect us to have all the answers. It's a really important point. The second is being able to say we've changed our mind, and the classic one for us was the advice on masks. And the WHO for a long time persisted with the advice. In retrospect, it's easy to go back and say, oh, why did we do that? Well, actually, because we thought that the mechanism of transmission was going to be droplet spread. That was a best guess based on first principles, flu virus, but actually it transpired it was aerosol spread. So the advice from the WHO around masks didn't change for a year. And when we did have to change it, well, sure, the media roasted us. But the answer was, we've got better evidence, and we want people to know what that evidence is, and to be able to use the to be able to all benefit from that evidence. The point is for politicians is that there's no mileage for them in saying, I don't know to a question, or I've changed my mind, let alone we got that wrong. And now I had to do the latter quite a few times, and I joke about the fact that on those days I'd be flying solo at the podium. Oh yes, Dr. Bloomfield will be giving the update today, and so there's first that, this didn't go right, sorry, we could have, should have done better. Then we have a challenge with the media where they love to use their favourite F-bomb, failure. So everything that doesn't go 100% perfectly, doesn't matter if it's a 1 in 100 year pandemic, is a failure. And I took this approach on this, and I found it really helpful to share because it relates to clinical practice as well. Actually, things won't go 100% perfectly. We won't always get it right. The only failure is if we fail to review and learn and adjust. If we don't do that, call me on it, but we're not going to get it right 100% of the time.
And call me on it if I change who I am on the podium. That's the other thing. I used to finish these interviews by asking people, what's breaking your heart? Because maybe there's a solution that exists that maybe we can collaborate on. And it just got really depressing, and I've stopped asking that question now. So I want to finish maybe with you first, Stacey, and then with you, Ashley. What gives you hope in this space? What gives you hope in this medical decision-making? What gives you hope in the public health space, especially with your new institute that you're looking to ramp up quickly? What gives you hope?
I think talking to healthcare providers, doctors, nurses, clinicians, they are such sincere and driven people, and I feel like the new information that we bring them on choice and decision making is something they embrace. The things that will be good about telehealth, they'll learn to embrace. Healthcare is arcing towards accessibility more and more, and that is something that gives me a lot of hope.
Cool.
I think there was so much positive that we can take out of the response to the pandemic, in New Zealand in particular, but elsewhere as well. And in particular, that the response of citizens when they trusted the message and the messenger, and the fact that they did actually look after each other. As I say, you can't police a lockdown.
Yes.
It relied on just about everybody just doing the right thing and not just staying at home but looking after each other. And I guess it shows what can be achieved if you extend the call to collective action in a way that people want to embrace it. They accept the invitation, and then of course the corollary of leadership is teamwork. and that's when stuff gets done. And so it gives me great hope for, I guess, our country, but also globally. And if we've got some, as every generation has, we've got some huge challenges that we need to face up to, not least environmental degradation and climate change. But it's within our grasp. We've shown that actually if we do act collectively, we can do something really great. And likewise for the health system, I think there was some, and for clinicians, there were some things that had to change overnight. And the extension of the use of telehealth, which would have taken, we achieved in 1 month. In fact, in a week, what would have taken 10 years. General practice went 70% online overnight. And my hope is, and I think it will be a reasonable hope, is that will be embraced and amplified. And I think the real potential here is to unleash the largest health workforce out there, which is individual people and their whānau and families, because they're the ones who do deliver day in, day out most healthcare. And I have a sense that maybe our health professionals saw that through the pandemic.
Well, kia ora koro. I really appreciate the time just to share the research, share the experience, share the knowledge, share the things that we have reflected on and learned from this. And we know that this is not the end. If it's not a pandemic, it'll be something else. There will be other things that we need to start to think about, where understanding humans, understanding behaviour, understanding communities, understanding how we operate together is going to be important to maybe not just our survival, but our thrival, I guess, as a country and as a nation and as a world. So really appreciate the service that you've both put into this space. Appreciate the time to kōrero with us, and I guess a big ka kite anō ngā mihi nui to you, and thank you very much.